Hi guys, this is me Gayatri Prakash and welcome to my page. എല്ലാവർക്കും എൻ്റെ പേജിലോട്ട് സ്വാഗതം. So today I'm going to talk or discuss with you all about today OET exam, 23rd April OET exam, in which I'm going to discuss with you all about OET writing and OET speaking. Okay, so let's move on to the topic. So what kind of the letter they have asked on 23rd April 2022 exam? So they have asked a simple discharge letter. Okay, because as I told you all earlier in my videos, like in my previous videos, we have total 3 types of letter. One is discharge letter, another one is transfer letter, the last letter is referral letter. Okay, so thereby this exam they have asked a simple discharge letter. And first of all, I would like to give about details about the patient and what is the patient condition, and next I am briefly explaining you how we can write the letter. All right. Patient name is Johnson, because I didn't get exactly the full name of the patient, because my student said his surname is Johnson and he is about 70 years above kind of age, because I'm not sure about that, but age and date of birth they have given, and they said like age is kind of above 70 years old. And the patient is a retired factory worker, lives with wife. Patient is a smoker and smokes 10 cigarettes in a day, and he was an ex-alcoholic. And patient is a diabetic patient, and he is controlling the diabetes under with the help of diet as well as with the medicines. He is having type 1 diabetes, and also he is a chronic COPD patient. And apart from that, the medical history, patient was suffering with COPD for such a long period, and he was like going to the hospital kind of on and off. And they recently admitted to the hospital because of shortness of breath and cyanosis. And that time patient was diagnosed with infective exacerbation of COPD with the help of diagnostic procedures, blood investigations and other relevant investigations. Thereby they have started antibiotics, steroids and inhalers along with O2 therapy. And patient is patient have made a good progress in his condition end of the day, and patient is going to be discharged, and then the patient is referring to the pulmonologist for the further care and management. So this is about the letter and patient history. So now we are going to detailedly see about how to write this letter with this help of information, because these all are the important informations that we need to write it in our letter. Okay, so first of all, as usual, we are writing the address on the top of the paper. So we are addressing this letter to a pulmonologist. So he is a doctor, and there was a name given in the case note. So whomever they have written the letter, they know the name of the doctor. So we are addressing this letter to a pulmonologist. After the address, as usual, we are writing the date of letter and then salutation, and then we are writing to the reference. In that reference, we are writing the patient full name with the prefix, as well as we are writing the age or date of birth, choices years. And coming to the point of introduction. To make an introduction, as you told you all earlier, that we need to make an introduction, we need 3 things from the letter. One is patient name, another one is purpose, the last one is patient condition. So here, as I mentioned earlier, the patient diagnosis in infective exacerbation of COPD, which means what? Patient is already a COPD patient, but his symptoms being again exacerbated and it became infective. So that's why patient admitted in the hospital. So that is the diagnosis of the patients. So we got a diagnosis to make an introduction. And next thing is purpose. Why we need to refer this patient to a pulmonologist? For what purpose? We are referring this patient to the pulmonologist for further follow-up, monitoring, as well as the treatment options. That's why we are referring this patient to the pulmonologist after the discharge. So now we are going to make an introduction. So Mr. X, for example, because I don't know the full name of the patient, so we just consider as a X, or Johnson. They said surname is Johnson, so we can make it as a Johnson. Mr. E. Johnson, Mr. Johnson, who requires your further monitoring and support, full stop. He is diagnosed with infective exacerbation of asthma, or else he is recuperating from infective exacerbation of asthma. So choice is yours. In 2 ways we can write an introduction in this letter. Coming to the point of present medical history. So how we can make a present medical history? As usual, from the date of admission to until date of discharge, what are the things that we have done to the patient, how the patient reacted to the treatment, and what about the prognosis of the treatment, prognosis of the patient and end of the treatment. So these all things has to be narrated in a concise and a clarity manner. So Mr. X was admitted on this day with the so-and-so symptom. So what was the symptom? Shortness of breath, cyanosis. And then thereby what happened? Patient has undergone chest x-ray, and patient undergone chest x-ray, blood investigation, sputum culture, which all confirm the diagnosis of infective exacerbation of COPD. So what happened? Thereby, consequently, he was initiated with oxygen therapy and treated with IV antibiotics, amoxicillin, and steroids such as corticosteroid and prednisolone were prescribed for the patient during the hospital stay. And after all those things, patient was prescribed with inhaler also. And what happened at last? Patient made a good progress and patient is being discharged today. And now coming to the point of social background. In the social background, we have to write about the social status as living status of the patient as well as past medical history. So patient lives with wife and he is a retired factory worker. He is a smoker and smokes 10 cigarettes in a day. And he has diabetes, type 1 diabetes, and it is under control with the help of your diet as well as the medicine. He is a chronic COPD patient and he is on medication for the same. Apart from that, the current blood sugar level is what? Because when the patient is taking steroids, especially the prednisolone corticosteroid, which will elevate the blood sugar level of the patient. So that's why we have to give importance to the blood sugar level, because in the question paper they have given blood sugar level which was somewhat elevated. And also when the patient was using the inhaler, patient was affected with the side effect of the inhaler, thereby the doctor reduced the dosage of the inhaler. So that 2 points we have to mainly mention in our letter, either in the present medical history or in the social background, no problem. And then coming to the point of discharge advice. So what the doctor exactly has to do for our patient. So in view of the above, kindly, here they have given us a discharge advice. They are recommending the doctor to reduce the dosage of the prednisolone because patient is already in steroid and also patient blood sugar is somewhat elevated. So we are recommending the doctor to reduce the prednisolone dosage as per the patient condition. So the point number 1, we are just recommending the doctor to reduce the dosage of the taper or reduce. The both are same meaning. Reduce or taper the dosage of the prednisolone as per the patient condition. Second thing is, we are just we can add the word is kind of, it would be greatly appreciated if you could support the patient for smoking cessation as well as rehabilitation therapy, which means the patient wants to get over with this COPD. So COPD rehabilitation support group, they can make him to participate and to know the disease condition and how to overcome the problem and how to change the lifestyle because of the COPD. So this all things will be discussed in the rehabilitation therapy. So we are advising the doctor, we are recommending the doctor to support the patient for smoking cessation because patient is smoking 10 cigarettes in a day. It's really too much for the patient as he is already a COPD patient, right? So we are just recommending the doctor to support the patient for COPD rehabilitation therapy as well as smoking cessation program. And also we are telling the doctor most importantly to monitor the blood sugar level because there may be a chance of elevation due to steroids. These all are the informations that we have to write it in the recommendation paragraph. Apart from that, there are n number of medications, especially this amoxicillin IV antibiotic has been shifted to oral antibiotic. So what is the name of the drug? I think it's a doxycycline kind of a name. So we can write it that one. So that remaining all the medicines, we can just say it as regarding the patient medications, which is already attached in this letter for your kind perusal. So like that we can write it in one word, and then we are just winding the letter. Please contact me for further details, and yours sincerely, because there was a doctor name my students mentioned that. So if there is a name of the person whom we are addressing, we can wind the letter with yours sincerely, or if there is no name and if it is given as a designation, you are winding the letter with yours faithfully. So this is a very simple letter and it's a kind of an easy letter. I hope you all have done in a very good way. Anyhow, hope for the best result. Okay, next, move on to the speaking topic. So regarding the speaking, what kind of the topics they have asked? Today they have asked about a laparoscopic procedure. Patient has undergone for the laparoscopic procedure and patient is on post-operative period and patient is worrying about the post-operative assessment. So we are explaining the post-operative complications, post-operative precautionary measures and everything we are just telling the patient. So which includes like pain management, PCA, patient controlled analgesia, and talking about diet modifications and talking about exercise program, mobility, and talking about the wound dressing management and the medication part, antibiotic and analgesics. So these are the points which includes in the laparoscopic procedure as a post-operative precautionary measures. Okay, and the topic number 2 was like a home visit nurse, a nurse who is going to visit, who is visiting a patient at home and the patient is diagnosed with a stroke. So the patient is already elderly patient and the patient wife is looking after the patient wife also is already aged person. So the nurse is going to take the blood samples for the stroke patient. And meantime she's talking to the wife, how is your husband, how he is getting on with the stroke and how you are managing at home. So she is talking about her difficulties. I am also aged and I am unable to look after my husband in a proper way. I am finding much difficulties. Like that, she is telling her concern to the nurse. So being a home visit nurse, as a community nurse, we are giving an advice to her about like home care management, such as we maybe get a home care nurse to look after your husband, and also she is offering a nursing home placement, and so she is giving a different options to manage the situation at home, as well as to look after her husband. And also she is talking, you can just giving a chance to her, you can talk to your family members, you can decide which option it is beneficial for you to take care of your husband, either a home care nurse, or else you are sending your husband to the nursing home or care homes to look after your husband because you are getting aged and you are also unable to look after your husband. And when she say okay, and she is also like what to say from the management, she's also telling from the management there is a people also will come and talk to you and explain to you how exactly the routines will happen in care homes or the caregivers who is doing a home visit. Like that, she is just explaining overall management plans, and also she is just waiting for her consent. So this is another topic. And the third topic is like patient is completed with the eye surgery, and we are just giving an instructions how to clean the eye and how to do the how to clean the eye and how to remove the dressing, change the dressing, and when onwards we have to use the eyeglasses. So regarding the importance of post procedure cataract instructions that we are giving to the patients. So we are just giving the instructions like how to clean the eyes after removing the dressing, and what are the eye drops and doctor has prescribed, and that things we are just explaining to the patient. And also we are explaining about importance of wearing the eyeglasses after the cataract surgery. So these are the health educations that we are giving to the patient. So these kind of the topics they have asked in today's exam. I hope you all have done in a very good way and hope for the best result. Okay, and whomever wants to join for the classes, and we are conducting individual classes also, we are having a group classes also. It's completely online based classes. We have 60 days, 40 days, 30 days classes, and mock batches also available. So whomever willing to join for our classes, please call us, and our number is given in the description. Until then, thank you. Bye bye.
Hello, my name is Shrutika Raskar. I'm from Pune, and I have recently got UK score, okay, in my first attempt. So it's really a great thing for me, and I really appreciate my teacher, Miss Gayatri, who has supported me throughout. Yes, it was really difficult to train me because it was like I already had some knowledge, and to refine it in such a way that I would do it and clear it in first attempt was a difficult task, as I always wished and I always told her that I wanted to make it in my first go, and finally I did it. So it is like I would really appreciate her efforts. She took it for me. I was always busy with my duties and with my work, but she always made time, and she always motivated me to just, come out of it and you just do it. You are capable of doing it. So all these things really matter. If she wouldn't have started with me, I don't think so I would have made up for this day. Okay, and to talk about her teaching skills, I just it was so systematic. It was just like, you know, it was in that format. I just have to go with it. So let it be anything, speaking, reading, writing, listening. She always shared with me. She was always sympathetic and more empathetic towards, you know, that how I am doing, my corrections. Yes, sometimes I was too much discouraged with my corrections, but of course she was there to motivate me to, you know, bring the good thing out of me, that I can do it. So that was the thing. I really appreciate you, ma'am. Thank you so much for making this come true. Till the end you were there with me, I know it. So this is really a great thing for me, at least. I'll never forget you. Thank you so